Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit. I am delighted to welcome you to our partnership launch with TRIAJ Inc. And Dr. Ike is here with us in stateside at the moment. And this is a very important topic. And our aim and mission here is to empower people to manage their own health and well-being. Dr. Ike is a pioneer in this space when it comes to pediatric and medicine and digital healthcare. I am honored and welcome. I want you to welcome him to this forum. Firstly, let me just give you a bit of background. Healthcare for children is a worldwide public health crisis, even in developed nations. And by 2030, the World Health Innovation Summit expects to reduce this mortality of children through disease prevention and improved access to illness and injury treatment. Timely medical care can improve the outcomes of disease with support from an innovative point of care intervention that provides evidence-based best practice care guidance, reduces medical error and provides a safe healthcare environment through a coordinated team. In other words, delivering SDG 3 for children. That's where Marty comes in. Marty and the pioneering work that he's been doing over the last, couple of decades. So Marty, let me just introduce Marty, and please just take a sip of your tea here because this is knockout. Marty is the founder and CEO of TRIAJ Inc. He's recognized as a medical and public health leader around the world, and he founded Safe Kids Worldwide. Please do check out Safe Kids Worldwide, global organization. He's raised over $350 million. It's incredible work, Marty, and focuses on local communities to prevent injury to children in 34 countries. And he's got 400 local coalitions across the US. Incredible stuff. Contributed to a reduced injury death rate for children by 61% since 1987. Dr. Ike founded and leads TRIAJ Inc. So, for me personally, this is a real honor here. The vision for TRIAJ Inc. is to save the lives of children through timely access to medical knowledge at the point of patient care. And it really is an incredible system. TRIAJ is a CRS system which exists today, is a pediatric health technology innovation that is mobile. It's an SAS system, a clinical decision support platform which empowers healthcare providers to provide best practice action-based healthcare. They have a number of different systems, and the next steps is guidance across 7 phases of hospital care. The mobile technology that's involved here is just phenomenal. The system provides a healthcare solution for physicians, nurses, community outreach personnel, and physician assistants, and hospitals, which create a baseline to care to address 4 areas, and they're real challenges for the healthcare system: access to current knowledge, medical errors, which we need to reduce. The costs are phenomenal in medical errors. Quality of patient care, which is vital, and the cost of treatment and medical education. Actually, that's 5 areas. One of the beauties about TRIAJ, and Marty will go into this, it provides free access worldwide. That's why it's so important that we partner with TRIAJ here today. We've had a number of announcements recently where you've seen diagnostic equipment. Now we need the technology to come in behind this, and that's where Marty and his team come in. Very exciting times. So you'll be able to access this. You can download it. Marty will give you all the information very shortly. But it's what's fascinating about this, medical knowledge. It just got so much to it, and Marty will go into the details. So I just wanted to hand over to Marty now, and Marty, the floor is yours. We're delighted to welcome you to the World Health Innovation Summit. This partnership is going to revolutionize healthcare around the world, and we're very excited to work with you.
Well, thank you very much for that introduction. I appreciate it. It really overstates a lot of the issues, but the reality is I appreciate it, and our partnership now with WHIS has just been fantastic up to this period of time where we're going to have the ability to collaborate with all of you worldwide to have an impact on children. If we do this thing correctly, we're going to save a lot of lives, and we're going to make it so that the healthcare in general for children will actually be something that's easy to get, easy access, and making sure that the doctors and nurses have the right information at the right time. So I thought I would just take you let's see if I can, okay.
There you go.
I think what I'd like to do today is just to give you a quick overview of what Triage Inc. is all about. We're a software company, and we have a platform, a communications platform, because what we're trying to do is to communicate information to each other so that it's useful and it's timely. And there are a lot of opportunities with many of you who are part of the WHIS system right now to collaborate with us to be the platform to get information out, especially about children. And digital health to me is on the cusp of really exploding. It's something we need to be part of, and it's something that will make a huge difference as we go forward. So I appreciate the fact that we're focusing on the SDG 3 and that we're part of a network of people that is important for the future of what we're going to do. I'm a pediatric surgeon. I've been at Children's National Medical Center in Washington, D.C. I have been fortunate to create a team of people at Children's National Medical Center that are really good at taking care of children in general. At the same time, I had the opportunity to reach out because we had a great trauma center. The problem with the trauma center was we were doing everything right. The kids were still dying. So the point was that we learned from that, because doctors and nurses are trained in hospitals, not trained outside of hospitals, was that the problem was in the community. And so to get to the community, we had to create a network called Safe Kids Worldwide, where we were able to create 400 coalitions nationwide in the U.S. where the injury death rate went down. As a consequence of that, we were able to really link with our colleagues worldwide. And consequently, because of that worldwide network, we're positioned from an injury prevention standpoint. And it goes right along with the whole goal of trying to address issues to prevent illness, or at least be able to treat illness and injuries in a way that children will benefit worldwide. Right now, there's a huge, huge problem because kids are not having access to the best information. And digital health is going to get that information to them in a way that's going to be very constructive. So one of the things that was interesting to us was the fact that just about 4 years ago, I was called from a colleague of mine who was in Kandahar, Afghanistan, who said, who actually I knew was a surgeon because he had been trained by us, having come through the Navy hospital here in Washington, D.C. So he was a military officer running the trauma center in Afghanistan. And he says to me, Ike, I got a real problem. He says, I've got a 6, 8, and 10-year-old who stepped on a landmine, and these kids are alive, but I really don't know how to take care of them. He said, would you help me? When he said, would you help me, I'm scratching my head saying, boy, he's 7,000 miles away, and these kids are hurt badly. I'm used to being there with the right information, taking care of the kids. So I said, yes, we'll work on that, which we did. But it proved to me that there was a knowledge gap that everybody has. I've had it. You've had it. When you go to the patient's bedside, you don't have the right information. So the question was, how do we close that gap? So to do that, we decided, after much discussion, looks like I got a little, let's see here. Okay. After much discussion, that we would create a software package so that we could put the information in your pocket so that it's available to you whenever you need it. The problem is that most doctors and nurses and corpsmen and people who are healthcare providers, they have to call somebody, or they got to go look it up in a book, or they go look at the website. Well, guess what? You may not be able to get to the right information, but if this is in your pocket, you know those kids are going to benefit tremendously from the information that you have that is simple, that's outlined in the checklist form, so that you can actually go through the process. It's like, you need to do this, and it will tell you exactly how to do this. So to me, it was just an exciting opportunity because I really wasn't sure that we could put this on a platform, a software package, and actually it turned out fantastic. I mean, I've been just overwhelmed myself. This is available to you. You can download it right now out of the App Store and see how useful this is. The problem we ran into was that we've run into is that medical errors are significant problems worldwide. In the United States, it's the third leading cause of death. So that means our profession is really not doing a good job. We work at hospitals. They're very difficult, unsafe places. So what we've tried to do is to figure out a way to deal with the numbers of deaths that occur worldwide, and at the same time, be able to have the doctors and nurses keep up with the process so that they're using the right information. That's the nice thing about this app, is you can change the information in the cloud overnight so that now you have a current piece of information that you can use on an ongoing basis. It's the problem we have with a lot of doctors. They don't keep up with things because they don't have time. The hospitals are demanding all this time of them. They don't have time to read anything. They just got to be able to perform, and that's increasing the cost because the patients are in the hospital longer. And the other thing it does is it really discourages doctors and nurses from continuing their profession. So they're stopping. They're retiring. So by providing them continuing medical education, we can make a real impact on the future of healthcare for kids. So the solution, or why would these doctors and nurses really be interested in doing this? Why would they want to use this app? Well, first of all, we're going to educate them and make it easier for them to get information. The quality of the care is going to go up. So that means the errors are going to go down. The providers are going to like it because they're working on the same page. They're all using the same process. Right now, if you go into a hospital, you get 8, 9 doctors that you're going to see. You got a ton of nurses. Everybody's doing things differently. We try to get them on the same page. If you do that, you're going to reduce the cost of this, and everybody's going to be able to feel like they've gotten more out of what they are challenged by today. So let's see, can you click on that I have a video there that doesn't look like it's going to work. What I would recommend you doing is go on the website, triaj.com, www.triaj.com, and this video will come up. It's a 90-second video. It just will give you a short look-see of how this is going to work. What the video will show you is that if you're a 3-year-old and you step on a landmine and you have a femur fracture and you're 15 kilos, you put that into the app and it will auto-populate their care from the time you see the patient to the time they're discharged. Each one of these verticals has a tremendous amount of information on it. I don't know if you can see this, but this information, do you see that arrow there, Gareth? This arrow? Can you see that?
I don't think I can see it, Marty.
Okay, so you just see the slide. So the point being is that each one of these verticals has a tremendous amount of information. And what it does is that all of this information is put on the app itself. So now you have this platform that's very flexible, and you have it all in your hand for the entire care that the patient needs. It's not calling somebody for one piece of information. It's giving you all the information. I hope that makes sense to you. One of the things that we've done with the platform is we've made it not only a clinical decision support system where you can get information to treat the patient, but it's an educational system so that you can train and educate doctors, nurses, corpsmen, or healthcare providers at any level how to take care of patients. So you can continue medical education, you can get credit for that, and we're putting that into our system so that it's an incentive, further incentive for doctors and nurses and corpsmen to go ahead and use this along with the information they get from the clinical decision system. The triage is a great thing, and it's a clinical resource system that really allows doctors and nurses to put their best information on a platform. The problem is you need a medical advisory board, and our medical advisory board right now is fantastic. It's global, it's worldwide. We have pediatricians, doctors, nurses on our team. These individuals come from Brazil, they come from Europe, come from Africa, here in the United States, in Ukraine. So there is an effort on our part to try to embrace the best knowledge base of people who can screen all of this information and put it into play. So where are we right now? Right now, we are thrilled with the partnership that we've created with WHIS, and that we think that that's going to be a terrific vehicle going forward because of all the countries that are involved. There are over 192 United Nations countries, so we have a lot of work to do. That's going to, at least we know we have a prototype now that works, which is the TRIAJ CRS. It's a clinical resource system that is second to none. It right now has 2,000 current resources on it. We've actually raised $3.5 million from friends, family, and angels to make this happen. We've created a brand new product plan that projects out over the next 5 years. And the thing that I like about this app is that it has the best evidence-based information that you can get. Where are we going to go? Well, the strategy, the direction that we want to go in is global, which we are already doing. We want to make sure that doctors and nurses have medical education opportunities to stimulate them to, while they're taking care of the patient, they actually get medical education. And we project with our 5-year plan that we will produce over 22,000 resources. Right now, remember, we've got 2,000 resources. In 5 years, we expect it to expand to 22,000. We're planning to implement artificial intelligence so that we can manage the big data, because every time you click on this app, the information now goes up into the cloud, into where you can actually apply artificial intelligence to tell you what's, instead of having one kid that stepped on a landmine who's 3 years old, you have 1,000 kids. Now you can download that information, use artificial intelligence to give you what is the best way to take care of the patient. And then you can immediately change your app as you go forward. So it's an iterative process that as you get better, as more numbers come into the system, your database allows you to make the best evidence-based judgments. Then the SaaS system, or the software package that we're putting together, will be placed in hospitals so that we can link them to the provider. What this is going to do is that every time you click the information on here, you can airdrop it into the electronic medical record. That means you don't have to do it but once, and you can do it any place worldwide. If I want to take care of a patient of mine that I happen to be in Brazil. I was born there, by the way. I speak Portuguese fluently. But if I was in Brazil, I could click on here and find out what's happening on my patient at Children's National Medical Center. The beauty of the new artificial intelligence and the digital network is that information is there for you to use immediately and change, and it will give you a dashboard as to how you're performing, as to whether or not you're above or below the median. I mean, that's a fantastic opportunity to stimulate improvement in healthcare. At the same time, we've got to be very, very concerned about cybersecurity, and we make sure that we translate everything into the language of the countries that we're involved with. So how do we get there? A couple of ways. One is we've already started the partnership, and we're focusing on SGD3. And so consequently, what we're going to do is we need investment. Our seed investment target right now is $5 million. That will allow us to accelerate going into the future to meet our standards for 5 years. But we're going to do that by basically 3 different steps. One is we're going to increase the development team, which are the people who build the app itself. We're creating an automated clinical resource authoring system, so it speeds up our ability to take information in and analyze it. And at the same time, we're going to make sure that we have artificial intelligence linked in this, which is going to be a tremendous accelerator. It's already happening. All you got to do is download it and use it a little bit, and you can see what the potential of this is going to be. Yes, there are problems, but the reality is in the next year or two, it's all going to be better as we go forward. So I think that the communication platform that we've created is something that's very practical. It's going to be as exciting as can be. I mean, I'm just overwhelmed as a surgeon, because I've had to learn a lot about this digital health area. It's really exciting what can be done today in this era. And I just wanted to give you one example of what we're doing in the Ukraine. About a year ago, without any funding, they called the government here, military called us and said, would you share this with the physicians in the Ukraine to take care of kids? Because a lot of them were dying, a lot of explosions and munitions that are happening over there. So we said, sure, we'll work at it. Well, we were able to create 4 different diagnoses that we provided to them And of course, this is in collaboration with the European Pediatric Surgery Association, which we're already reaching out to people all over the world by having to build this system, so that these network that we created in the Ukraine, we made available to them either through the digital system with the iPhone or through our website. A lot of this information is on our website. We provided them, how do you take care of a blast injury? Many of you out there have never ever seen a blast injury. Well, they're overwhelmingly complicated. We have a one-page summary of how to take care of that child. Head injuries, burns, radiation injury. So the point being is that we are already making an impact on countries overseas. And with this network that we're going to be part of with WHIS, we're going to see that expand and become more effective. So I encourage you to make every effort to get on our website and take a look and see what we're doing. Because I think if you are part of our network and help us think through the problem, then Triage clinical resource system will be available to everybody. No matter what your background is, no matter where you're coming from, we can adjust your database and put it on the communication system going forward. It's exciting because that way everybody can be using each other's resources on an ongoing basis. So I think that what we've tried to do is to make sure that Triage Inc. is available to reduce the number of injuries, treat illnesses, and be part of a network of people who are committed to saving the lives of kids. We have to do that. There's no option. All you can do, go to your TV every night, you see how many kids are getting hurt, how many of them are sick. So part of this effort that we're making is to make sure that that happens. So I thank Gareth and his whole effort to bring all these people together, because I know how difficult that is. And because of that, now we can actually make it so that people have in their hand the Triage clinical resource system that will save kids' lives. Thank you very much, Gareth.
Thanks, Marty. I think it'd be worth me showing the video to give people some context here. So I'll add it to the stage and we can have a quick look. It's a fantastic system. So
what if communication made all the difference?
Turn up the sound.
What if a split second a child's life? This is Triage, a revolutionary mobile network designed to assist in the treatment of injured children. It's a pediatric patient database that allows you to create detailed and in-depth profiles that follow patients from injury to discharge. But Triage is so much more. It's an advanced clinical decision support system that reduces uncertainty in the treatment of pediatric patients. By using real-time guidelines created from evidence-based best practices, Triage suggests sequences of care and can help you track procedural steps along the way. Its simple functions and intuitive design integrate seamlessly and help you monitor progress during medical procedures, all through the Triage network. It deliberately links the phases of medical care and can be customized with the help of our advisory board with decades of practical experience. Triage will help you avoid medical errors while improving the quality of patient care, all from your mobile device. Communicate timely information while enhancing collaboration for the healthcare team, from first responders to nurses and physicians. Triage. Save children's lives, just-in-time care.
So I think that's great for people to get an insight into the context here, but also you can see how transferable this technology is, for lower middle income countries. I think it's really important to understand here, with 3.5 billion people who don't have access to healthcare. That's almost half the population. So we really need to be able to mobilize, come together collectively and be able to collaborate to be able to scale these new technologies up. That's part of the reason why we're working together in this digital space. So, I just wanted to thank Marty for joining us today. you know, we have this solid partnership now. We have a roadmap, and the whole idea here is to build this partnership out. We'll have quite a few announcements coming up. We've made quite a few announcements this week as well with new partnerships, and we've got some more partnerships coming up. So I'm very excited. And just to keep you in the loop, we have a new partnership on it's called with Medicine Quality Music Foundation on Monday, the 15th of April. And then we also have a new partnership with Ride for Freedom. So just very quickly, just wanted to put that out there. These are new partnerships that we're building. And again, with TRIAJ, we will be able to interface with all these new partners and be able to give communities access to this technology so that they can manage their own health and well-being. It's a very exciting time. So from myself and Marty, we will sign off. But delighted you could join us for this launch, and we look forward to working with you now and in the future. So thanks, everyone.